Okay, Diane, we have a roll call.
Schaefer,
Here.
Bouchard. Here. Campbell,
Present.
Dimash,
Here.
Stanton,
Here.
Rarig. Here. Ordway.
All right. Would be happy to entertain a motion to approve the agenda as printed.
So moved.
Support. Motion with support to approve the agenda as printed. All those in favor say aye.
Aye.
Opposed? Okay. On to number 5, approval of the consent agenda. We have to entertain a motion to approve the consent agenda as presented.
I'll make that motion.
I'll support. Motion with support to approve the consent agenda as presented. Are there any questions, comments, or concerns? Hearing none. Diane, can we have a roll call?
Yes. Dimash.
Here. Yes.
Yes.
Bouchard. Yes. Campbell,
Yes.
Rarig. Yes. Schaefer.
Yes. Okay, number 6, included in the packet were the draft planning commission meeting minutes from June 23rd, 2025. Those are not approved yet. They are just for your viewing pleasure. We're on to number 7, first public comment. So we've got a fair amount of public here tonight. Does anyone like to come forward? All right, hearing none. Let's move on to the county report with the county commissioners.
All right, so many of you probably saw the article in the paper about the health department cuts. So as a reminder, we have a district health department we share with Eaton County. 3 Berry County commissioners and 3 Eaton County commissioners serve as the Board of Health. And I'm the current chair. So every election cycle that rotates from county to county. And at this election cycle, it came back to Berry County. I took over as chair in January, and who knew it was going to be so fun? So in April, the health department eliminated 9 staff positions, and that was following a cut of $850,000 of federal funding. In June, Eaton County announced a 25% cut to their allocation to the health board, to the health department, as they are in a bit of a financial crisis. They their second public safety millage did not pass. And so they've had to make some very severe cuts in Eaton County. And they've come across this, now they're cutting all outside agencies by 25%. We don't know if that's going to be the end of either the federal cuts or Eaton County cuts. So that was a result in $225,000 of a loss to the health board budget. So over $1 million. And then we in Berry anticipate that there'll be a significant cut as well, to keep the balance of Eaton and Berry contributions to be similar and fair, right? So we've taken a couple of steps to figure out how we're going to navigate and still meet basic services in both counties. The Connections program has been, department has been fully disbanded. So that was 4 staff members. And they were a department that connected people with resources. So often the health department would, or the emergency department at the hospital or doctors would connect people, residents with the connections program so that they could try to navigate through the various services that they could need. So that program will no longer be available to them. The health officer, Colette Scripture, was going to retire in October of 2026. As you can imagine, she's been with the health department for almost 30 years, I think. She was at the highest point in her pay scale. And so we looked at opportunities to incentivize her to retire a year earlier. And so she has accepted that and tendered her resignation effective October 1st of this year. So we'll have a year savings at that highest rate. The same with Jay Van Stee, who is Director of Environmental Services. And he was at the high end, so we're hoping to replace him with somebody, at a lower pay rate. And there's also some restructuring happening. So you'll see some more positions also be eliminated. So there's cuts to discretionary funding, training, travel, materials, any of those things. We're scouring the budget, but we're in the budget process right now to try to keep us as lean so that we can provide the services that we need to. Thornapple Township, I mean, I know from back in my planning and zoning days, we did quite a bit. We relied on the health department for septic and well reviews and permits. You can expect that those kinds of things are going to take a little bit longer, less staff, and the fees are going to go up. So that's probably where you'll hear it most from residents, is that that's where they'll also longer wait times in the clinic for vaccines or procedures or testing. Scaling back in all community events, partnerships and coalitions, and did see the final draft went out for the posting for health officer to our HR firm. We have a contract with an HR firm, so that's going to be posted here in the next, hopefully, 5 to 6 days. And then that'll be a 6-week opening where we collect, and then we'll interview potential health officers. Any questions on the health department first, and then I'll let go. Yeah.
After all that good news, we approved a 3-year installment plan with High Point Bank for the purchase of body cameras, car cameras, portable and mobile radios, which come to a little over $800,000. Approved submission of a grant from, to put in for a grant from MMRMA for that same paraphernalia, the cameras and radio. Approved a contract with Motorola and Crouch Communications to buy these cameras and radios. And we approved a chill grant, which is a grant to improve low-income homes. Did I miss anything?
No.
Any questions?
Thank you, County Commissioners.
Please.
Well, I'll take reserve time. We have none. And the mayor on the machine.
So, the 19th will be 3 years that I've been here. Thank the board for the support over the last 3 years. This last month, we had our busiest month that we've ever had, 302 calls for service. For our paid on call responses, which I think is around 20, I didn't write that down. We averaged 7.8 members per call. The one structure fire that we had within our township, we had 11 members show up. Last year, depending on how close the fires were to our station, we were meeting the NFPA 1720, which is having 10 firefighters on scene within 10 minutes. So that's one of our goals for this year, is to continue to keep people and getting people on scene quickly. Our out-the-queue time continues to drop slightly every month. We're down to 1 minute and 23 seconds. Trying to incentivize people to get that a little faster out the door times during the day when we're not sleeping and having to get dressed. Response time within Thornapple Township is 7 minutes and 22 seconds, which is pretty great. That's from the time of the alarm comes in to being on scene, not from being en route to on scene. And outside the township on calls, we're at 11 minutes and 23 seconds. And I think we're covering like 144 square miles right now. That's pretty impressive. I think the biggest thing to note, last month, we had 2 cardiac arrest saves, same people, same providers on the same day. And Joe Johnson and Mike Powell. So one of them is going to be coming out of the hospital. It's in rehab right now. He's coming out of the hospital. I hope to have his wife start CPR right away. I hope to have them to a board meeting when time allows for both of them. So the other excitement is in the last month, we had two nights that we had 3 calls within 50 minutes. And this was like 10 o'clock at night, and we scrambled crews together and didn't turn any calls over. We maintained all of our own calls with people. So we were talking to the station about what's happened over the last 3 years, just a kind of a recap of a few things that's happened. When I started here in July of 22, we had 1 advanced life support ambulance staff 24/7 with 1 paramedic and 1 EMT. Today, we have 2 advanced life support ambulances, 1 24 hours a day, 7 days a week, 1 staff from 8 in the morning till 8 o'clock at night. The primary ambulance that's on for 24 hours is staffed with 2 paramedics. The other one is staffed with a paramedic and an EMT or another paramedic. And then Monday through Friday, we keep a basic life support ambulance staff with 2 basic EMTs. All this has been paid for by the work of the people who do the work. We haven't asked for taxpayer and more taxpayer money. We'll be able to manage that with just the work that they put in. Back in July of 22, we had 4 active paramedics, 5 if you count me coming aboard in July. Today we have 21 paramedics that work for us. 8 of them are full-time. When I started here, we had 16 paid on-call firefighters that were on the board. 4 or 5 of them hadn't actually shown up to a call in a couple of years. Today we have 29, and we have 36 total firefighters that provide care to the community. And we have 5 or 6 more going to fire school this fall. We've sent 5 people through paramedic school through grants. They've all been successful. We've had 7 people go through EMT school and grants that are on our staff. We have 5 in EMT school right now that are on a grant. And we'll be having another EMT school this fall that we anticipate 3 more people will be going through. We turned over about 15 calls a month when I first started here. We only turned over 7 calls last year total. We turned over 6 so far this year, but that's because we were in other communities helping out on their turnover calls. We've had a significant increase. The big goal that I haven't met yet is we've been working at trying to get everything back together so we can redo our ISO rating. I'm hoping to have that done for next spring. We're pretty close to having all the documentation that we need. So kind of a recap of last 3 years, some goals to be set for the next 3 years. And I appreciate all the support you guys have given me.
Thank you.
Thank you.
Question? Do we have any kind of life-saving award, like
I'm gonna work-
ribbons or something?
Yeah, I'm hoping when they're out, I would like to give that to because on both of those calls, we had multiple other first responders that came and helped, and I'd like to make a presentation of it. But yes, that is my plan to do that when he's discharged.
Okay.
So, thank you.
Thank you, Chief.
I got a question.
Yeah.
Can you explain how do you incentivize the people to get out the door faster? What's the
I
incentive?
usually have a stick. What what it is I keep telling them, it's better, but it isn't great. I'm up in my office and I beat them to the engine. I'm a 53, almost 54-year-old man. I keep telling them you're getting beat by an old man and you're down on the first floor. That incentivizes a little bit. And I keep telling them that these numbers are important. These numbers drive better outcomes. And that's kind of what I keep telling people. Like, when we want to have good outcomes, we need to have good response times, and we need to be out the door quicker, and we need to get water on the fire faster. So all those things matter. And I've been saying these things for the last 3 years, and they're starting to get through to people. So.
Okay, that's good. It's, I guess you'd call that, leadership by example, incentivization by example. And, you know, there's other ways to do it, monetary or whatever. And what you're doing is obviously very effective, and I appreciate it.
I appreciate
I
it.
recognize it and appreciate it.
Thanks, Ross.
I think if you just talk about the morale of the station, I mean, that's something you didn't touch on, but it's wonderful.
Yeah.
It's an atmosphere that you don't feel like you've got to cringe when you walk into.
My first day, all the shades closed. Laying in the chairs, looking back at me. Oh, we've come a long way. I'm proud of all the members, and then this is their work. I'm there, but it's from them. It's from them working hard. I couldn't do any of it without them.
All right, thank you, Chief. All right, unfinished business, there is none. On to number 12, new business, letter A. Received an agenda request for hiring a part-time election coordination clerk assistant. The recommendation is to, and I said we make the motion and then we discuss it. The recommendation is to, I'd be happy to entertain a motion to hire an election coordination / clerk assistant permanent. And I'll make that motion.
I'll support.
Motion with support. Are there any questions, comments, or concerns?
Shouldn't this go before the personnel committee, before a recommendation before it's brought here?
I think that is probably wise.
So where's Cindy?
Yes,
Family emergency.
it's a family emergency,
Okay,
and it's,
I would think she'd be the one that would want to present this.
I think she may have wanted, but it's,
Yeah.
she's unable to be here tonight. So are there any further questions, comments, or concerns?
I'm not willing to approve that without having the first write down here.
Yeah, all right. I will withdraw my motion. And who supported
Warren, I did.
for it?
Let me table it. Or we take, or take it.
Let's make a new recommendation.
Oh, okay.
You withdraw your support.
What's wrong, Max?
Okay, I'd like to make a new motion that we turn this over to the Personnel and Compensation Committee. And decide what we're gonna do from that point. Both. Maybe Cindy, I don't know if Cindy wants to be involved in that committee or wants someone to step in on her side. She can talk to us about this. Yeah, my motion is that we move this to the Personnel and Compensation and make a decision based on their recommendation.
I'll second that.
Motion with support. Are there any questions, comments, or concerns? Hearing none, all in favor, say aye. Aye. Opposed? Okay. We're on to letter B, which is a agenda request for trail maintenance. Background, it's basically what we agreed to with Jason with the addition of $1,000 and another person to help him work on the trail. I visited the trail with Catherine and Jason has made amazing progress, but it is somewhat overwhelming, and especially for one person. It would make sense to have someone to help him with it. Jeremy Schreiber has offered to do that. And we would need to add him to our insurance, the same as what we did with Jason. Jason is added to our insurance policy now. But my recommendation is to contract with Jason Mills and Jeremy Schreiber for trail maintenance and mowing on the township-owned trail from Garbo Road to Parmalee Road for a cost not to exceed $5,000 for the remainder of 2025. And I'll make that motion.
Support.
Motion support to contract with Jason Mills and Jeremy Schreiber. I'm not gonna read all this. For maintenance of the trail from Garbo Road to Parmalee Road for a cost not to exceed $5,000. Are there any questions, comments, or concerns?
Question. To be under our work comp, doesn't he have to be an employee?
No. Well, he did fill out a W-9.
Subcontractor.
Yeah.
Contract.
Contractor.
Okay.
So,
That's my.
and our insurance agent was fine with Jason being added, and it's a minimal amount.
Right, okay.
Are there any further questions, comments, or concerns?
Yeah, that question of the insurance, shouldn't that amount be considered in the fiscal impact?
It is.
That's include the 5,000,
Yeah.
including that?
Yes, because I added another person to the insurance and his earnings from the maintenance of the trail.
Probably under $100, I'm guessing, for the insurance.
Almost double that, but not
Okay,
quite.
all right.
But anyways,
That's not, I mean, that's just liability.
yeah.
Yeah.
Are there any further questions, comments, or concerns? Looking back at Rob.
That would be for liability though, I don't think, is it? Oh, I thought you were talking about comp.
I don't think it's hurt.
Pardon?
If it gets hurt, it'd be like,
Well, yeah, I guess I'm thinking liability, like, you run over someone or,
Right.
Yeah.
That's
And-
really all we're looking at. I don't think you'd be working with comp on this.
Oh,
Well, there's probably still not a discount.
no,
is that employee?
no.
Oh, so we only get.
so it isn't.
Right.
Okay,
The W-9 covers that.
okay,
It's probably just liability.
okay,
Yeah,
Hurt something.
Okay.
He's out there doing work for the township.
okay.
all right. Any further questions, comments, or concerns? Hearing none, Diane, can you roll call?
Varig,
Yes,
Bouchard,
Yes.
Campbell,
Yes.
Dimash.
Yes.
Schaefer,
Yes.
Stanton.
Yes.
All right, we're on to the last agenda request, and I'm gonna let the chief take over. But there was fiscal impact. Oh, did you wanna, what were you talking about with this one?
Bill is asking for approval of bipolar shirts for his
Right,
training class.
yeah. I'll let the chief speak to it, but I thought you said he didn't have the
The
cost.
cost is built into the class fee is what's in the sheet.
Oh, yeah.
Yeah.
Yeah, you didn't put down how much it was. You have
$1,734 and some change, I think.
Okay,
sounds right.
$1,800.
1,800.
1,800.
exactly.
No, not to exceed 1,800. Yeah, you put how much was left in the account, but not how much this was.
Okay, so chief, you want to speak?
Yeah, so the class that we're putting on currently, when we send people out to do clinicals, they need to be dressed in Thornapple garb, so they can be easily recognized with their students. The cost of the polos are incorporated in the class and the $1,550 that they're being charged. So I don't even know how much we've collected, Joe, I think between you and Joe, maybe maybe half of the people paid by now, I'm not sure, but at the end of the class, there'll be a little bit more revenue than expenditure. And this is just part of the cost of doing the class. So
All right, with that I'd be happy to entertain a motion to approve the purchasing of polos not to exceed $1,800.
I'll make that motion.
Sorry.
Motion with support to approve the purchase of polos for EMT school not to exceed $1,800. Are there any questions, comments, or concerns?
Yeah, you're gonna have to have more for the fall class, correct?
we will, but that'll be again incorporated into the class
Right.
fee. We had a few extras because
Yeah.
we bought extra because they actually run big and people think that they don't. And so we bought a few extras of each size because Erica put
That's
hers
not
on
good for
the
Erica.
dress, so. I don't really wear a large and all of my polos are mediums. So they just run big.
So if the cost is built into the class itself and we've approved the class and the cost, why do we have to do this?
It's not like a standard supply for the class, like he's buying.
It's an extra
It's kind
purchase.
Buying equipment, he's not, unless we end up with just a list of what all you want to say you're providing for the class, we didn't really have this for that. But we were approving tubing and equipment to check whatever you guys do. Whatever. Like, this is just like not in my mind, a normal thing that you have. It's not ambulance supplies. We figure we got.
No,
we got
it's part of the
supplies, we got a
training.
teacher.
It's part of training if they have to have it to go out on their clinicals.
I don't think it hurts to approve it and have it.
I say we do
It's kind of like
We can do it.
err on the side of caution.
I mean, I still gotta
It'll
write
look
the
good
check.
Our auditors to have this approved.
Still gotta write the check to buy the shirts.
All right.
All right, any further questions?
Things redundant, but okay.
Any further questions, comments, or concerns? Hearing none, Diane, can you roll call?
Yeah, Imaz.
Yep.
Schaefer,
Yes.
Stanton,
Yes.
Bouchard,
Yes.
Campbell,
Yes.
Rarick.
All right, we're on to number 13, committee reports. Admin, anything you think of, Laura?
It's fair week and we're man in booth.
Fair week is going on.
Feel free to volunteer for an open spot.
Is
There are none open, I took everything.
I know, but maybe you can give one up.
Yes,
There's like 56 hours out there.
Offer small.
All right,
Let me see when the open slots are, so I can see if I can help out.
okay. Cemetery? I don't think Cindy's got anything. She didn't bring it to our attention if she did. Middleville DDA. The music series is going along well. We are planning the Fall Fest at this point. I think that's, not the Fall Fest, sorry, Heritage Day. Heritage Day is September 13th. Make sure you come out to enjoy the Rotary Parade and Rotary Duck Race, and they've got many other things going on. Turkey dinner at the fire department. Lots of good things, a dunk tank.
Oh, no.
So we're gonna be looking at A, people to fill it, and B, people just to be in it.
Yeah.
And my theory in the dunk tank, as long as the water level keeps going down, you're okay. All right, elections, I don't think Cindy has any updates on that. Emergency services, Ross?
I think we nailed it.
Okay. Finance?
No.
Parks and Rec, luckily I have the director here.
Chair.
Chair, not director.
The So we had our quarterly meeting scheduled for this week, but because we didn't have enough folks that were gonna be able to be at that, canceled it. So sent you the notice and make sure it gets.
It's on the door.
Okay, great. We have our board workshop, so TAPRC board members will have a workshop to go over the 5-year rec plan. Like results from the survey and potential goals and objectives. And then we have our joint entity meeting that's scheduled for September 22nd. And that'll be held at the Emergency Services Building. Did you reserve that room?
I did.
How well our programs?
Well, and so that will be an opportunity for the 3 entities and the TAPRC board to look at the survey results and look at what the goals and objectives are for the 5-year rec plan for the next 5 years.
We're gonna skip back to finance. Some late breaking news.
No, I just thought of something. We made our yearly payment to the road commission this month. 170,000 for roads. So,
All right. Personnel and compensation. Obviously, we've got to have a meeting scheduled to go over the agenda request.
Maybe do a duo on that, because I got my August as well. July and August are packing up.
Okay.
But I'll be happy to support it,
Okay.
be around.
Property and public utilities. Dave,
No updates.
no updates. Okay, roads and highways. I have it under advisement that we made our road commission payment.
I've been on that committee.
Is there anything you'd like to add?
I don't have anything.
Okay. Duncan Lake Sewer.
I don't have anything there either. Unless you do from being out there probably once in a while.
I don't have any updates. It's nothing out of the ordinary. It's
We haven't had much rain, so I'm pretty sure we're not getting that.
we're overflowing. All right, on to number 14, second public comment. Would anyone like to come speak? All right, going once, going twice. We're on to number 15, poll of numbers. Dave.
I guess the only thing I'd say is congratulations to the chief for almost 3 years here in a couple days. So, nice work.
Sandy.
I guess I will go along with that, but I hadn't thought of it, but okay, we're doing a great job.
Thank you.
I could dovetail on that. What a reminder that we should have said during our EMS committee comment part was, it's time for us as the EMS committee to look at chief's review, annual review. Now that he's had an anniversary.
Maybe that's why he just
Think
said
he just
everything.
gave you that.
He's trying to set us up for this.
Yeah.
I printed it out for him.
Yeah.
We just sign it. We're just signing.
Hate to forget.
Okay, Kurt.
My hat off to the entire EMS crew. Thank you. I have a question about time card submission. We had a meeting with a joint village board meeting. I don't know whether to call that a committee meeting or a board meeting. And most of us, I think all 4 of us were there.
I was there.
That's right. So
I thought that was a party.
it goes on time card. At least
I would say we met as a board. I
Okay,
think it would be a board meeting.
okay,
And that's why we're there to make,
yep.
I think I put it to this committee.
Yeah, I think mine went through as committee.
Yeah.
is there a substantial difference in?
Right,
Yeah,
yeah.
there's a difference in pay on committee versus board, no
Yeah.
question.
Should we,
We weren't there making decisions, so I kind of,
what it was there? I mean, we're asked to be there as a board and we showed up as. I would call it a board meeting. And if you guys want to go, retroactive on.
Don't submit it. Call the board meeting and don't submit it.
Right.
I'll go
Yeah,
back and
we'll
change it.
work that out.
Thank you. That's all I have.
Hey, Laura?
Well, I guess we're all on you today. Congrats, Bill. Keep sending me paperwork.
That was a fist shake, wasn't it? What was
Yeah.
it?
Keep sending me all that paper.
All right, on to me, chief. I just can't believe how
Fast 3
wonderful
years
it is for you to, and how quickly the 3 years went by. And it's great to have you on staff and, I just such a forward thinking, you're doing a great job.
I appreciate that. Thank you.
And with that, I'll add, the fair is going on this week. If anyone wants to come up and relieve me from my sweaty booth, I'd appreciate it.
It's gonna rain this week, so you have that.
Oh, that'll add the heat. It's not the heat, I wish the humidity. Anyways, I would be happy to entertain any motion to adjourn.
I'll make that motion.
Or motion with support to adjourn. All those in favor say aye. Aye. Opposed? We are adjourned at 7:37.